Hello everyone, once again welcome to my Oet channel. Today we will see one role play explanation. This is exam question. The exam date is 28 September 2024. So the setting is emergency department. You are seeing a patient who has sustained a burn on their left hand. You see the patient on triage, collect details about the injury and provide information on treatment. So before going to the explanation, I would like to tell you something regarding the setting. Always the setting is much important in case of Oet role play cards, because according to the situation or according to the settings, the tone of the role play or the presentation will be completely different. In case of home visit, the introduction is totally different. In case of clinic, like a GP clinic or surgery clinic or something, it's most probably you will not be knowing the patient. In case of emergency department, it might be like unknown or can be known scenarios. In the ward, it might be like most probably you are going to tell something regarding the procedure, something regarding the surgery or discharge plan, or what all things, but you are familiar with the patient. So according to these settings, the explanations or the presentations will be completely different. So you have to concentrate on these settings first. So emergency department, then you can go to the scenario. You are seeing a patient who has sustained a burn on their left hand. You see the patient on triage. So you are in the triage, collecting the details about the injury and provide information on treatment. That means completely you can understand that this is a new patient. You don't know anything about the patient and you are going to get or going to collect complete detail from the patient and going to give some information regarding the management. Okay, so reassurance is important in every role play cards. Here you have to collect as much as possible. So the half of the cards will cover the questions. So the patient side will be large enough to give the answers, but from the half side to the end, till the end, you are the one has to talk more. So that's the thing, you have to keep it in your mind. Let us go to the task first. So first one is to find out the reason for the visit. So that is the introduction part. So you can start like this. Good morning. My name is Reshmi. I am one of the staff nurses working in this emergency department. Please take your seat and how can I help you today? So that can be the introduction, or else you can just ask their name as well. Like after your introduction, you can just ask me, how may I address you and how can I help you today? So like that also, you can just introduce. The answer might be, good morning, sister. My name is Joseph and I came here with a burn injury. So I am so much concerned about this burn is happened on my left hand. So that may be the introduction from the patient side. Then find out the details of the burn. So what are things it's given in the bracket. So you have to be careful how and when it happened, pain level, any treatment tried. So you should not skip any questions. That is important actually. So you can just sympathize, then you can go to the task. You can just sympathize. Oh, Joseph, I'm really sorry to know about your injury, but no need to worry. We are here to help you. Before going further, may I ask you some questions about your burn injury? Then, once after getting the consent, you can just follow the questions. Joseph, could you please explain me how and when it happened? So either you can ask one question alone or two questions together. But here, pain level has to be asked separately because you have to give the scores. So it can be like special question. So you can just ask when and how and when it happened. So the answer might be, oh, sister, it's in the morning. It's happened when I was cooking. By mistakenly, I spilled my tea on my hand and it became like a blister. So I'm so much worried about the pain and the scar and everything. So how and when everything is completed. Now we are going to ask about the pain level. How you can ask the pain level? There is particular sentence. You can just by heart it. Well, Joseph, if you rate your pain in a scale of 0 to 10, where 0 is no pain and 10 is the worst pain ever you had, where you will rate your pain? So that is an exact question. So the rate may be 8 out of 10, sister, maybe. So like that, if you get answer above 7 or above 7, that is severe pain. So you have to sympathize there. Oh, Mr. Joseph, I'm really sorry to know that you are in severe pain. No need to worry. We will give you some medications to resolve your pain as well. Is that okay? Then, any treatment tried? Then you can ask that, I would like to ask you another one more thing. Have you tried any treatment at home? So, it may be like a general thing. Maybe the answer will be yes, sister. Actually, I washed the area with clean water and I just applied ointment. So what I had in my home, so it was a burn gel actually. So that's only will be the answer. Then we can tell that we can just appreciate. Oh, Mr. Joseph, it's good that you have applied some burn gel over the burn area. So it's good that you have applied. So the scar formation will be, we can reduce it. So that's finished from there. Then you can go to the next task, provide information on the treatment plan, general cleaning, examination by doctor, apply dressing, etc. Explain that the dressing will help promote healing and prevent infection. So we can tell that, Joseph, thank you so much for all your answers. So let me explain you regarding the treatment plan, what we are going to do. We will clean your wound like with sterile water, and the doctor will examine your wound and we will apply the dressing, and the dressing which will be helpful for proper healing and to prevent further infection. Is that okay for you? Or you can ask, how does that sound? Or you can ask, do you have any costing or do you have any concern on it? Then, advice on medications. No infection, antibiotics are not needed. Over-the-counter pain relievers like ibuprofen or paracetamol if needed. Encourage the patient to keep the hand elevated to reduce swelling. Then you can add to the point, Joseph, I just want to tell you regarding the medication as well. After the examination, if the doctor could not find out any signs of infection, most probably antibiotics will not be needed. And you can manage your pain with any over-the-counter pain relief such as ibuprofen or paracetamol if needed, and it is accessible in all pharmacy outside. Moreover, you can keep your hand elevated to reduce the swelling. So when you are taking rest, always just keep a pillow and you can keep your hand above the pillow to reduce the possible swelling. How does that sound? Or are you able to do that? So like that you can ask. Next task is reassure the patient about scarring. Minimize scarring with the proper care, no other options before healing. Offer guidance on scar management once the burn heals, like moisturizing the area with a gentle cream, avoiding direct sunlight, use silicone gel, sheets to reduce scarring. So, in between you can just ask question. Joseph, do you have any other questions to ask me? Then, if you get any role play card with a burn, of course, you can see the concern regarding scarring. So the question might be, yes, sister, I have a great concern about scarring. According to the size of the burn, I hope it will be big enough. And I just want to minimize the scarring or just to prevent complete scarring. Do you have any management for that? What can I do at home for that? So you can just explain like this. Oh, I can truly understand your concern regarding scarring, but no need to worry, Joseph. I will give you some information regarding scar management. In case, like according to the size of the scar, we can manage with some home remedies. Like we can take proper care of the scar, but please wait until proper healing. After healing, I will give you like some guidances. You can just follow that. Keep it in your mind for now. Once the burn heals, please moisturize the area with a gentle cream. Please try to avoid direct sunlight. Instead, you can use silicone gel or sheets on the burned area to reduce the scarring. Are you okay to follow that? Then, next task is advise the patient on signs of infection like increased redness, swelling, pus, or fever, and stress the importance of seeking medical attention if any symptoms appear. Then you can add to the point, Joseph, I would like to advise you few more things to keep it in your mind, like signs of infection. It is important that after burn, please check for any signs of infection such as increased redness, swelling, pus on the affected part, or if you feel fever, please try to contact as early as possible. And I would like to tell you that if the symptoms appear, please don't wait or don't waste your time, because the infection, if it starts, it will get worse very soon. So it is my humble request to consult with your doctor as early as possible if you see or if you feel any such symptoms. Are you getting my point? Then the next task is confirm follow-up instructions in a few days for dressing change, any additional checkups. Find out if the patient has any further concern or questions. Then you can ask that. And one more thing I would like to add, is a follow-up instruction. After getting discharged today, you will have scheduled for dressing changes or any additional checkups if it is needed. Your doctor will inform you further. Please attend all those appointments on time, because it is important to change dressing in particular days to prevent further infection, and it will promote your healing as well. And do you have any other questions for me? That is important thing. Before ending up or before winding up, you have to ask that question. Do you have any more concern? Do you have any more questions? Or something like that. The answer, if it is not, if there is no other questions, you can just wind up. Like you can tell that, Mr. Joseph, I hope I have clarified all your doubts. Please follow all my advices. In case if you feel any discomfort or if you have any signs of infection or anything, please feel free to contact us to get an appointment as early as possible. I wish you a speedy recovery. And please wait here for doctor's consultation. I will get your doctor and I will come back as early as possible. Because this is emergency department, you are not going to send the patient home. So the patient will wait to see the doctor. So these everything you have to plan ahead during 3 minutes preparation time. So I will give you one tip. You can just write simple sentence at the end of the role play card, like what would be the like a wind up sentence, like please wait here for a few minutes, I will get your doctor, or could you please wait in the waiting area for your turn, I will let you know when doctor arrives. So something like that, a simple sentence. You can just make it, you can make a note under the last task, so it would be easy for you to wind up, because you will think about the time and it will be hurry-burry, so you will not get exactly the word. Maybe you will search for the words how to conclude it. So it is easy if you're out there during 3 minutes preparation time. Okay, so I hope this roleplay explanation will be useful for you, and please see my playlist in the YouTube channel. There are a lot of informations are given, example common information regarding OET, all modules, letters. Under letters there are different categories. Reading, listening separate, and speaking also. There is separate playlist, so you will get few advices, tips, some roleplay explanations, recent exam questions, roleplay cards, and everything. And we have one small online OET academy. If anyone want to join in that, you will be allocated with specific tutors. Recent exam questions will be provided, so you can choose your schedule, or you can fix your schedule with your assigned tutors in your flexible time. So every informations are given in the description, the contact number and everything, so you can just have a look in that. And if you need any clarification, please feel free to contact in that WhatsApp number. Thank you. We'll see you with another one informative video. Until then, bye, take care.